Okay, well, let's move ahead with a little discussion on confusion/controversy in regards to pelvic exams for asymptomatic women at their annual well woman exam when it's not the year for their pap smear, which is typically every 3 years. Not always, but it depends. If things are going well, every 3 years. So for this discussion, here are the references. You can look at the ACOG committee opinion on the well woman visit 2016 and the American College of Physicians screening pelvic guidelines in adult women. So what is the controversy? This is where I'm having trouble moving my slides forward, which is annoying. Let's see, I'm going to move, there we go. All right, so here is the comparison slide. So basically, back in the old days, we did a pelvic exam, including the external inspection, internal speculum exam, and the bimanual exam every year. And ACOG on the left says, it's current with 2016, they still recommend doing this annual pelvic exam based on expert opinion, not so much evidence, but expert opinion. But at the same time, they recognize that there's not great evidence either supporting or refuting the annual pelvic exam. We're definitely not collecting the pap every year, but that doesn't mean, you can't take a look, do the internal exam. And they acknowledge this can be a shared decision with the patient, that you can actually decide just not to do it. The personal and family history may guide this decision, even if your patient's been totally healthy, let's say. Let's say a relative had a cancer of the external genitalia or other issue, that they're going to feel better being checked every year, even though the actual pelvic exam might have a low yield for detecting many conditions. And then they reiterate in this document that pelvic exams are not needed before oral contraceptive prescription, as we covered in the last case study, and nor do you need to do a pelvic exam these days to screen for gonorrhea and chlamydia, thanks to the newer urine testing available for those conditions. And certainly, I think there's something to be said for this. Not every woman is getting out the mirror to check out the external stuff that they can see. You could find a case of herpes on inspection, or genital warts that are visible on inspection. Usually if somebody has a Bartholin's cyst that's worrisome, it'll be painful, and they'll come to you with that complaint. But they may have one and haven't noticed, and have things going on they just haven't noticed that you could catch by doing this exam. On the other hand, the American College of Physicians, they recommend against screening for a pelvic exam, period. They're not saying don't do the pap. When you do the pap every 3 years, you're going to be doing a pelvic exam to collect the pap. And they really don't give a lot of support, if you read this whole document, for the bimanual being very sensitive or specific at detecting certain conditions. And again, this is all in asymptomatic non-pregnant women. And same for the speculum part, that you do have to do that to collect your pap. This is more evidence-based, I think. Anytime you're going to cut back on a service, I think you have to really prove the case. But they specifically say the exam will rarely detect non-cervical female cancers, and it's not associated with improved healthcare outcomes and lacks diagnostic accuracy. There's a risk of false positive findings, which in turn will lead into potential harms, including unnecessary subsequent procedures. And they really discuss in some detail the fear and anxiety and pain and discomfort that the pelvic exam procedure causes. And, I think there's a lot to be said for that. And they specifically talk about special subsets of women that have been subject to sexual assaults and such, that this can be especially traumatic. They look at women who are overweight having more discomfort with the anxiety of having a pelvic exam than women that are not overweight, and all that stuff. But they do acknowledge, I guess, the little silver lining, in favor of the pelvic exam that they do not recommend, is that you can catch a bacterial vaginosis that's asymptomatic. I mean, if they're symptomatic, they're going to have a fishy odor and a milky vaginal discharge complaint. But sometimes they have BV without complaint, and it can predispose women to other STDs having this vaginal infection. So it is good to treat it when you catch it. So, but they still recommend against that. So without further ado, we'll go on to our case. And the focus here is cases of women 21 and up. We did the younger ones last case. And so for reference, looking at the cervical cancer screening guidelines, we have the ACOG's FAQ reference that is provided to you in this week's module. And here is our patient. Her name is Michonne. She is a 33-year-old female. She has no history of prior abnormal cervical cancer screening results. And due to the zombie apocalypse, she has not had a screening in over 7 years. And what type of cervical cancer screening does she need today? What do you think? Well, there's two options here looking at the reference document. One is preferred over the other. The preferred is doing both a Pap test and an HPV test. That's yay or nay, HPV, not typing. That's preferred. Or acceptable, maybe you're at a clinic that has low resources, taking care of uninsured patients. It'd be acceptable to do the Pap test alone every three years for Michonne. And then under this, it just, if we have negative results, you can actually repeat the code test and go to 5 years in this case. Okay. Well, you decide to do the code testing, the preferred test. And we have the results now. The Pap is normal, but Michonne is positive for HPV, human papillomavirus. So let's go and answer a few questions here. What do you want to tell Michonne about HPV? What I would like to tell Michonne about her HPV is that this is an extremely common infection. It's the human papillomavirus. It is a virus that causes just regular old warts and other places on your body. Certain strains of it are linked to the development of cervical cancer, which is what we're screening for, but also linked to some other cancers in other areas, including head and neck cancers and some anal, penile, and vulvar cancers as well. What's the good news about HPV? The good news is that most of us actually clear this virus over time. That is why they have made the move to do Pap smears later on 21-year-olds and not do them when women are 18, because As women become sexually active, often in their teenage years, they are by and large exposed to this virus. Hopefully that'll change with HPV vaccine. But with, I think, estimates, in the recent past have been about 50% of sexually active people have been exposed to HPV. There's a high chance you're going to run across this in your lifetime if you're sexually active, even with one partner in your whole lifetime. It's like a 50% chance. So if you have a couple partners, 3 partners, which many people do before they settle down into a long-term relationship, chances are they're exposed to this, but most people get exposed and their immune system does what it's supposed to do and clears the virus. And that's why we're delaying the first PAP testing partially, and then why we have these intervals between the HPV testing like we do, because the changes that HPV causes that lead to cervical cancer are very slow and steady versus something that happens just within a year. No, it takes several years. So that's why we can extend out these intervals. Instead of doing PAPs every year, we do them every 3 years. So I tell her all this, that there's a good chance you're going to clear this. Most people do, but there's a little subset of women who don't, and then we have to take next steps. And you've already told her how this is so common, so I would just reiterate that with any feelings of stigma and shame. It's nothing that a partner usually knowingly passes on, because most people don't get the warts with this. In fact, some of the strains of HPV that cause warts aren't the strains that are linked to cervical cancer. Okay, and to move on for the next step for Michonne, the options for next screening interval, let's go and look at the 2012 updated consensus guidelines for the management of abnormal cervical cancer screening tests and cancer precursors. That's from the American Society for Colposcopy and Cervical Pathology. So if you'll turn to that document, let's see, it's going to be figure 3 on page S8. That is going to give you the clue to figuring this out. What's next for Michonne? Okay, so for Michonne's next screening, and now she is statistics-wise a 33-year-old female with a normal PAP, HPV positive. Looking at figure 3, we have 2 options here. We can immediately order HPV typing to look for types 16 and 18, which are the strains of HPV highly associated with cervical cancer progression. And the equally acceptable option 2 is 1 year from now, we can repeat the co-test, which includes the PAP test and the HPV test. So option 1 is, I guess, more aggressive in that you're going to do something right away. And option 2, you're going to wait a year and give Michonne some time to clear the virus and then just recheck everything. Repeat the PAP test, look for abnormal cervical cells, and see if in a year she's still positive for HPV. All right, and here we are. You choose the 1-year option instead of doing the typing, and sure enough, 1 year later, the PAP and HPV tests are repeated. The PAP is normal, and now her HPV has gone from positive to negative. You just reiterate the discussion with her that your body usually can clear this virus given some time, and that's what's happened. And so now, again, looking at figure 3, when will you ask her to come back? Yes, if you follow the diagram, she's going to go back to repeating co-testing in 3 years. What if her HPV test was positive at the repeat co-test? Look at the center of the diagram, and yes, she would go to colposcopy at that point.